Reform is never easy, but it is vital to reform our NHS because I want it to be there looking after every family in the country, doing a really good job into the future. Now, we had a constructive and helpful meeting, and what's clear is there are quite a few myths we need to bust about this reform. You know, choice for patients is a good thing. Integrated care is a good thing. Making sure that GPs, not bureaucrats, are making decisions, that's a good thing. So there are myths we need to bust, but I also heard how on the ground, where some of these reforms are already taking place, you're actually seeing better health outcomes, GPs doing more things for their patients, people leading healthier lives as a result of these changes. So I'm committed to the changes, committed to taking them through, but we need to do everything we can to explain to people this is about improving and enhancing our NHS, not in any way endangering it.
It's the wrong way to run the NHS. It's the kind of bunker mentality to exclude people who disagree with you. What the Prime Minister should be doing is listening to the doctors, the nurses, the midwives, the patient groups who are telling him to drop his bill. And then he should sit down with them and other political parties, and I stand ready to do this as leader of the Labour Party and chart a better way forward for the National Health Service. And I think it tells you all you need to know about where David Cameron has got to on the NHS. He's lost the confidence of the medical profession, and he's lost their confidence to such an extent that he's got to exclude them from the meetings. You know, the doctors, the nurses, they're the people you should be sitting down with. And as I say, I'll sit down with him too if he drops his bill and say, let's get a better way forward for the National Health Service. And if we can all agree on that, that will be a good thing for the NHS, a good thing for Britain.